Macular degeneration is a very common process and one of the leading causes for vision loss in the elderly in the U.S. So I thought I'd take this opportunity to explain a little bit more about what exactly macular degeneration is. So the first question is, what is the macula? That's probably an excellent question. Let's answer this. This is basically a cartoon I drew of the eye. And for light to get into the eye, basically it comes in the front of the eye through the cornea, through the pupil, goes through the lens, and that's where people get cataracts, and hits the back of the eye way back here in the retina. So you can kind of think of the eyeball like a camera. There's a bunch of lenses in the front. In the back, there's the film, and that film is called the retina. So we can actually look at the retina in the eye doctor's office by dilating your pupil, looking into the back of the eye. You can look at that retina, and it looks something like this. This is a picture of the retina in the back of the eye. In fact, this is my retina. And there's a couple of different structures. There's some blood vessels that supply the blood supply. There's an optic nerve. But this little dark area here is probably the most important part of the eye, because that is called the macula. So the macula is the part of the retina, it's part of the film in the camera that's responsible for your central vision. So in other words, this is the part of the retina that's most important. It's the prime real estate. If you're going to build a house or buy a condo, this is where you do it, because the macula is the part of the retina, part of the film responsible for your central vision, the part of your vision you use the most when you're looking at things, when you're reading, watching television, driving. So this is the part of the retina that's the most important. And unfortunately, with macula degeneration, this is the part that's affected. A simplified definition of macular degeneration would be kind of like the film in our eyes getting a little worn out as we get older. And that's all it is. Our retina is starting to get a little worn out. So, one big question that always comes up is, what is the difference between dry and wet macular degeneration? And I don't think people do a very good explanation of this. Hopefully I'll do a better job. Basically, the vast majority of people have what we call dry macular degeneration. And by dry, I mean it's just the run-of-the-mill deterioration of our retina. So over time, things get slowly blurrier and blurrier, and your fine visual acuity gets worse and worse. Very slow process. For some people, it never gets quite bad. For others, it really can be a big detriment to their vision. But it's almost always only in the central vision, never causes a whole lot of peripheral vision loss. And this is not a process that, even if it's really bad, causes complete blindness in the sense that you can't see anything. And so the vast majority of people have dry macular degeneration, and the vision maybe slowly over the decades gets worse and worse. Sometimes you can do things to help yourself see better. I usually recommend lots of light with the reading. Make sure your glasses are up to date, and make sure you get checked up. So dry macular degeneration. Now the other kind is called wet. I think this is a little bit of a misnomer. What they really should have called this is bloody macular degeneration, not wet, because what happens is that the retina in the back of the eye starts to get so worn out and deteriorates so much that new blood vessels break through and blood vessels bleed, and you have a sudden bleeding event inside the back of the eye. And this can occur kind of acutely. I mean, it can happen like that. And if this does happen, this needs to be treated right away, because there are things we can do to treat wet macular degeneration. Because you want to stop this bleeding, because you don't want blood in the eye, because when blood heals, it has a tendency to scar, and the last thing you need is scarring right here in the prime real estate of the eye, right where your central vision is. So dry, regular process happens slowly over time, and it can turn into wet if there's any bleeding in the back of the eye. And if that happens, if there's an acute change, something needs to be done. So the big question is this: what can you do to keep things from getting worse? Someone told you had a little bit of early macular degeneration, and you're wanting to do something proactive. Well, there's 3 things that have been found to be helpful. The first one is don't smoke. Smoking accelerates this process, can make dry macular degeneration worse, might even help convert it into wet. So don't smoke. Probably the best thing you can do to prolong your lifespan anyway is don't smoke, but certainly with the eyes, don't do it. Second thing, there's been some multi-center trials looking at thousands of people with early macular degeneration, trying to find things, medicines maybe, that will keep it from getting worse. And there's been some evidence that a multivitamin with a supplement called lutein may be of help in keeping some forms of macular degeneration from advancing, or at least slowing it down. And so if you're trying to be proactive, sometimes a multivitamin with lutein, go to your pharmacy, ask your pharmacist for a good one that's made for the eyes might be helpful. The final thing is you want to monitor your vision. If you have sudden vision change, you want to pick this up because if you're having bleeding back there, that needs to be treated right away. So, for monitoring the vision, sometimes I give my patients what we call an Amsler grid. This is a grid of lines on a piece of paper. Just put this on your refrigerator. I usually tell people, you know what, once a week, cover one eye, look at this thing, look at that little dot in the middle of this thing, make sure these lines look pretty straight in your peripheral vision, and then cover the other eye and do the same thing. I've had people come in completely blind in one eye and not even realize it because they used their other eye and they never really realized that their vision was so bad. So it's usually a good idea to check on your own. Cover one eye, make sure the other eye is seeing fine, just to make sure there's no big changes. Because if there is, maybe there's bleeding going on that needs to be seen. The second thing, regularly scheduled dilated eye exams to look in the back of the eye, make sure there's no bleeding back there. And sometimes we'll take a photograph with a machine called an OCT to make sure there's no blood vessels breaking up and causing any problems. So that's macular degeneration in a nutshell.
For more informative videos like this, visit us at tomokaeye.com. Or if you would like to make an appointment to see one of our doctors, please call 386-672-4244.